Welcome and good afternoon. Today is with us Professor Pablo Cardinal Fernandez. He is Medical Director of the HM International Department, Madrid, Spain, and the Coordinator of the Intensive Care Unit, HM Torrelodones University Hospital Madrid, Spain. Thank you very much, Professor, for accepting this interview. I'm very honored. And as always, with us, Francesca Rubolotta, President and iWIN, and Director Intensive Care Unit at McGill University in Montreal. Thank you very much to stay with us. Professor, you organize an online congress for developing countries, and in the program, there is a session on quality and diversity. Could you tell us something about your congress and collaboration with iWIN? Thank you.
Well, the World Day of the Critical Lung is a non-profit, academic, bilingual, and online event organized by the Pan American and Iberian Federation of Intensive Care Societies. And the aim of the Congress is to spread high quality knowledge related to lungs in critical situations from an inclusive point of view. This is the reason why we consider that the session we usually organize with the iWIN committee is very important, because women's it's clear that have a very important and relevant role in ICUs, and give the floor and give the visibility to the women are extremely important.
Thank you so much. Professor, women don't apply for leadership jobs unless they have 100% of required competencies. Why is that according to you? What needs to be changed? Thanks.
From my point of view, I think things are changing. It's clear that are changing. Francesca is an example that things are changing. Really, I don't understand why. Because I'm a doctor, because my mother is a doctor and she inspired me. I think it's something that is unacceptable now. It's something that I don't know why. I have to be honest and say that I don't know why. I think it's just a tradition, unacceptable right now.
Okay, thank you. And iWIN's aim are centered on innovation, diversity, equality, advocacy, leadership. Would you add or prioritize something? Thanks.
Sophia, could you repeat the question, please?
Yes, of course. iWIN's aims are centered on innovation, diversity, equality, advocacy, and leadership. Would you add something or prioritize something?
Pablo, I think you are also having the same aim in your conference.
Yes, it's a difficult question. Obviously, medicine is innovation. The soul of the medicine is to innovate. And obviously, leaderships are those who have to change, to guide, and to promote this change, this new thing.
Yes, and you started this conference several years ago. Now it's 6 years or 5 years ago? Six years.
Yeah, this is the six years, yes.
So much before COVID. Now we have a lot of online material, But when you started, this was innovative. There were no other conferences for countries that could not afford to fly to expensive places. So now an online conference seems any conference, but 6 years ago, this was unique. Is it?
Yes, that's true. Really, when we think about this project, our aim was to bring all the knowledge to all the areas, independently from the cost, independently from nothing. The idea was to just to spread high quality knowledge. Why? Because we were aware that sometimes it's impossible to fly, it's impossible to afford the cost of the Congress. Sometimes you can't travel because you are in a country in war, for example, or you are in Africa or whatever. For that reason, the idea was to just to share the knowledge in a free.
And you did it for free, so that the knowledge had to be shared to everyone for no cost.
Yes, absolutely free. Nobody pay for nothing. All the speakers deliver their own lecture by free, and we don't require a payment for participate in the event. No, it's all free, because the idea was just to share the knowledge.
And you did it in 2 languages, and we know that Spanish is spoken in many countries and in many developing countries. So you did, this is a bilingual conference, which is also unusual.
Yes, it's a bilingual conference because for the same reason. We think that most of the countries from the third world speak in Spanish, and obviously they need, and I was born in Uruguay, thus I can say that I need high quality knowledge. For that reason, the idea was to translate all the lectures in English to Spanish and Spanish to English, because the idea is to be inclusive as much as possible.
Okay, thank you so much for your time. I look forward to meet you in Catania when iWIN will take place for the 3rd edition, I hope. Okay, Francesca, do you want to add something, please? Or...
Yes, I want to thank Pablo, because we found ourselves in agreement for many ideas. And that's why I think the collaboration was very important. So I want to thank, because this year is the 3rd year that iWIN will have a special session in the conference, and this will allow our content to be translated into Spanish and to reach countries that we will not be able to reach otherwise. So Pablo, thank you. This is a clear example of a successful collaboration that iWIN has established over the years, and it's a great opportunity to have you today. And this year we will focus on success stories. So when is your meeting? Is it in what is the date of this year meeting, Pablo?
November the 30th.
So on November the 13th, we will present iWIN success stories during the International Day of the Critical Lung. And then we hope to see you in Catania on the 30th of June for our meeting.
It will be a pleasure. It will be my pleasure to be there.
Thank you, Sophia.
Thank you so much. Bye.
Bye.
Bye.